Let's give an applause for Dr. Debra Munsell.
Well, I probably don't need this microphone, but we'll use it anyway. I am blessed to be able to stand before you today and talk about something that I am very, very passionate about, and that is oral health. And Pastor Knox said in her introduction that I had worked at MD Anderson Cancer Center, and I worked with people who had cancer of the head and neck. And I saw many of those people came from Mississippi. Uh-oh, I better turn it up. Many of those people that I took care of were from Mississippi. And that kind of drew me to Mississippi because I thought, maybe I can help out. Maybe I can take care of people, and maybe I can talk to them and teach students as well how to talk to patients when I'm not around anymore. So what we're going to do today is, if I can get all organized, we're going to talk about oral health. And when I talk about oral health, what do you think? What do y'all think about when I say oral health? Anybody? Teeth, gums. Let's see. Good. Well, oral health is more than just teeth and gums. It includes your tongue and the back of your mouth where your tonsils are, all around the tops and bottom of your mouth. And how we got started with issues in the oral cavity is cavities. Now you would think that that's the dentist's area, and I'm not a dentist, but any healthcare provider that you go see can look in your mouth and see how your health is doing. Did you know that certain diseases are connected to cavities when we're younger and when we're older? And tooth loss, gum disease, tooth decay, all can lead to some pretty serious diseases, some of which we could have in this room, me included. Good. I'm going to let you guys look at this picture of the mouth, the oral cavity, and take a look at the different parts, because I might say some of the list some of the sites there. But let me give you a few facts. 3.5 billion people in the world have some kind of oral disease. And the most prevalent disease worldwide is dental decay, cavities. And those cavities and that bacteria in our mouth can affect our entire body. And some diseases we're finding out now can be prevented if we take good care of our mouth. Now in Mississippi, 58% of African American adults have had one or more permanent teeth removed, and 52% of white adults. And in adults over 45, 15% African American adults and 13.5% white adults have lost all of their permanent teeth. That's a big number of people. And when you talk about what your teeth and your gums do for you, that's a big impact on your lifestyle and your way of living. So what we want to do is try to start educating people about how to take better care of our oral cavity. So, what do you need to know about oral health? Well, did you know that you can detect certain diseases by looking in the mouth? Diabetes, high blood pressure, certain other diseases all have some origins in the oral cavity. What happens is we eat something, and after we eat, if we don't rinse our mouth or brush our teeth, we get that white fuzzy stuff on our teeth where our teeth feel kind of like it's fuzzy. That's called plaque. And in that plaque are little bacteria. And they love that stuff. They like the sugars, they like the starches, they like the potatoes and rice and corn and cornbread and biscuits. They like all of that stuff. And when they start eating that, they make acid. And that acid is what eats the holes in the teeth. So that's how things get started. It also causes inflammation around the teeth in the gums. Have you known anybody in your family or perhaps yourself had some bleeding on your gums maybe after you brushed a little too hard? Well, that's that bacteria working against your body. So researchers have been looking to see what affects these bacteria in our mouth are doing to the rest of our body. And they've linked that bacteria to diabetes, high blood pressure, heart disease. That's 3 things I have right now. Strokes, mouth and tongue cancer, Alzheimer's, something everybody is concerned about. Premature death, dying early when you don't have to die early. They're even linking it now to rheumatoid arthritis. We know that women, when they're pregnant, it's very important for them to take care of their teeth, because if they have infections in their mouth, that can affect the baby and cause preterm labor. And we have a lot of preterm labor here in Mississippi. Things like pneumonia and COPD or emphysema can also be related to oral cavity issues. So how can we do something about this? These pictures up here will show you what cavities look like. And we've all seen children with cavities. We probably all in here, I know, have had cavities in our mouth. And what's something that comes to mind when I say the word cavity? Pain. They hurt. Think about these little children who are going to school. They can't learn really well if they're in pain, if they hurt. So we want them to be able to go to school, eat a healthy diet, play with their friends, and spend time learning instead of spending time in pain. Also, that bacteria and plaque that we have can cause that inflammation of the gums, and that can lead to tooth abscesses, and those things are very, very painful and cause lost time from work, causes students and children to miss school. And we know that these are things that we can prevent. So how can we prevent tooth decay? Well, first of all, let me see. That's just a picture right there of how that inflammation can affect way down into the areas around the bottoms of your teeth and cause the pain. This next slide also does the same thing, shows you how that inflammation affects all of the tissue. And we know that the blood circulates in the body, so if it's circulating in the mouth with that infection, it's going to go other places, like the heart, like the brain, like your lungs, and cause a lot of inflammation. And that's a big word for redness, swelling, inflammation, things that are painful. And that inflammation, we know now, causes some of these diseases that we have as adults. Diabetes being one of them. First of all, it's not the only thing that can cause diabetes, but it can contribute to problems with diabetes, these inflammatory processes in our mouths. So today, now that you know a little bit about how things get going, now that you know a little bit about how plaque and inflammation can also affect your heart and your brain and lead to high blood pressure, heart disease, and stroke. Well, what are we going to do to prevent that? Because we can prevent some things. One of those things is getting evaluated by a dentist or a healthcare provider. Your nurse practitioner, your physician assistant, your primary care doctor, your internist, even your cardiologist can look in your mouth and see what's going on in your mouth to find out where some of this inflammation may be starting. Well, what happens when we go for a dental cleaning? If we're going to a dental hygienist for cleaning and the dentist. I know when I was growing up, that was not something that, where I lived, I could do. Because we didn't have a dentist or anybody in our town. And that was not something my parents could afford. So I was way old before I got a chance to go. And some people are frightened of going to the dentist. Look, that going to the dentist is like going to the spa for me. I love it. I was there at 8 o'clock this morning. You get to sit in a nice chair. Someone takes a nice soft brush and cleans up your teeth for you, puts some polish on a little polisher, polishes them all up, looks for those cavities, and you know, if it's your first time there and you've never been, they have to do a little bit of scraping, but it's not a painful procedure at all. And you can sit there and relax. Sometimes they even give you earphones to listen to music. You could fall asleep and they would still give you a good dental cleaning. So there's nothing to be afraid of and nothing to be worried about when you take your kids and when you take yourself to get a cleaning. So what are they looking for? They're looking for inflammation. They're looking for redness and swelling in your gums. But they're also looking for signs of cancer in your mouth. Now, not a lot of people get head and neck cancer. But if you've ever known someone who has head and neck cancer, it's bad. Because what do we do with our head and neck? We eat, we speak, we swallow, we chew. That's our face. That's who we are. And if you have to take part of that away, it's very, very disruptive and disfiguring to patients. So dentists and healthcare providers want to prevent those types of things. So they're going to be looking for any kinds of signs of cancer or inflammation. If you get started regularly, or you get your kids and your grandkids started regularly with a dentist, they can help them prevent some of those issues. What can I do? You know, what can I do as a regular person going about my daily activities? How can I change what's going on in my mouth? Well, we know that we should brush our teeth twice a day. Usually, you can brush them as many times as you like, but twice a day is good. And we need to do it for about 2 minutes. Well, how do you know what's 2 minutes? You could sing happy birthday twice in your head, and that's about 2 minutes. And that's what we teach little ones, to sing happy birthday. You could get your watch or your phone or the kitchen timer on the microwave, whatever. You can do it for about 2 minutes. The most important thing is, though, you can start by eating healthy foods and pushing back for some of those starchy, sugary stuff. And I love a good sugary orange drink or a grape drink, but that sugar is food for those acid-producing bacteria. And if we're gonna have those things, we need to rinse our mouth out and brush our teeth to get that out of there as soon as we've done that. We need to do some flossing. And people will go, I don't want to do that. I don't want to put my hands in my mouth. Well, you just wash your hands and you get out a length of floss. And here, if anybody wants to have somebody show them how to do it, we have a bunch of students here who can demonstrate that. How to do it right. Get in there and clean that plaque out of your teeth. Eat natural. Did you know that apples are natural toothbrushers? When you eat an apple, that helps get some of that plaque off your teeth. Eating healthy foods is better for you than eating those gummy but good peach cobblers, stuff like that. We got to brush our teeth and get that plaque off after we eat that peach cobbler. We need to avoid alcohol. I didn't say stop it all together. Nobody can do that. But try to avoid it if you can. Try to make sure that you don't add problems to your mouth that you don't need. Also, smoking or using tobacco products is very, very harmful to your teeth, and that's what, together with alcohol and not taking good care of your teeth, can lead to head and neck cancer, and you don't want to get that. Moms, this is something that wasn't taught to me when I was having children, being of childbearing age, that mothers can help their children have good oral health simply by breastfeeding them instead of bottle feeding. Now, some people can't do that, we know, but taking that bottle away from the baby when they're finished and just taking a wash rag and wiping off their little gums, that's all you need to do. Not putting them to bed with a bottle or letting them run around with I'm guilty, sweet tea in the bottle, you know, Coke in the bottle. I'm preaching to myself here. We can stop that and help those little first baby teeth come in. And it's important to take care of those baby teeth because they set the road for the permanent teeth. So we don't want them to get cavities either. So if we can get moms to just wash their babies' gums off and with a little wash rag and regular water, that goes a long way to helping those teeth come in great. And they found that if the baby teeth are coming in correctly and not having cavities, it's more likely that their permanent teeth will come in correctly, and they will come in with a better chance of not having to have braces later on because they have got a nice straight foundation for those teeth. So also, when moms are pregnant, we have to tell them that having their oral health is something that they need to have checked. So if you've got someone in your family who's pregnant or may become pregnant, you need to tell them, look, you need to go get your teeth checked, make sure you brush your teeth, keep your mouth clean, because any inflammation or infections in that, in their mouth can be transmitted and cause to the baby, and maybe is connected to preterm birth. We don't want that because we know sometimes those babies have a lot of trouble later in life if they have to overcome that preterm birth. Also, one thing that we're all guilty of and we know is moms will sometimes, if the pacifier is dropped on the floor, what do? We pick it up, we put it in our mouth, and we give it back to the baby. Don't do that. Get some water and wash it off. Sometimes when we feed babies, they don't want to eat. So we take a little bite, and we give them a little bite. That's giving them some of your bacteria. So we want to feed them their food, and we keep our food. So if you have someone in your family that has young ones, start them off right. Help the babies have better teeth, and they will be much thankful for it in the long run. This is what we've talked about already. No propping up the bottles, no sugary drinks. The amount of time a child could be in school if they only did not have the pain, dental pain, headaches, and all of the troubles that come with cavities, children would be having much more achievement in school. They can learn better. They can interact with their peers and not have, imagine how grumpy you would be if you had 5 or 6 cavities and then you had to go to work in pain. Imagine what those kids feel like. So it keeps them from being able to concentrate. So what are we going to do about the diabetes and the heart disease? Well, some of the things that we're going to talk about are just simple things that you can do for oral health that can help prevent diabetes. If you already have it, you still need to take care of your oral cavity. But if you can start your kids and your grandkids early, perhaps they won't get it. Healthy eating, leafy green vegetables, fresh vegetables, nice, healthy food, dried beans and corn, fresh vegetables, things that are bad for our oral health, fast foods. And everybody has had fast food because we live in a fast world, but avoiding it as much as possible. High sugar, high fatty foods like Captain Crunch cereal. It's bad for your teeth. Very, very bad. Carbonated sugary drinks. Alcohol, of course. Candy, hard candies, because they can crack your teeth and have sugar in them. Things like that. Avoiding those can help you avoid some of the pitfalls of bad oral health. I'm going to leave you here with some questions, but some people might say, what am I going to do? When do I need to get worried? Let's see. When do I need to get worried about something going on in my mouth, and who should I see? Well, any bleeding around your teeth or gums, any pain in or around a tooth, pain when you're eating or chewing, any sores that come up in your mouth that last 2 weeks or more, definitely, and any kind of pus coming from around your teeth. Those are signs you need to get to a healthcare provider. Could be your nurse practitioner, your family practitioner, your PA, even your cardiologist or a dentist. We all know that we have a shortage of dentists in Mississippi. So any of those people, you don't have to go to a dentist. It's great if you have one available because they can try to get you in, but those are some worry signs. But what you can do every day is simple. Brush those teeth, floss those teeth, and try to avoid those things that cause us to start having those inflammation and cavity